I know you've been hearing that some people, they have a blood transfusion, then later on they have a reaction from the blood transfusion, right? But probably maybe you have not had an idea of how it actually looks like. Okay, so we'll get to see the clinical features of this word blood transfusion reaction. So if you have a blood transfusion reaction, how will it look like? Okay, how will it look like? And that's what we're trying to look at in this video. So clinical features of blood transfusion reaction. So you can also say acute hemolytic reaction, still the same thing, right? So we look at what we have here before we come back to look at these systemic things. Okay. So clinical features of blood transfusion reaction. So let me just give you guys an overview. I didn't even give you guys an overview. It's just like, okay, they transmitted some blood into you, but this blood is not compatible with your blood, or it could be that the blood that they transmitted into you has some infection. So this problem is coming from what? Inappropriate screening and cross-matching of blood. Okay, so the features of this, right at the site of what? Transfusion, there'll be pain there. Okay, there'll be fever, there'll be chest pain and tightness. The patient will experience difficulty in breathing. Okay, because it's just like the blood are fighting each other. Like, do you understand? The patient will have hypotension. There will be tachycardia, rapid heartbeats. There will be diffuse bleeding, right? There will be jaundice. Okay, so jaundice may appear late. All right. We're talking about a systemic one now. Like, let's go in depth. Under the heart, okay, that's, I'm sure, the organ effect. Under the heart, there'll be increased heartbeat. That's what we said tachycardia here, right? In the systemic overall, the person will be experiencing fever and chills, right? Then vascular, okay, there'll be hypotension, there'll be uncontrolled bleeding because the clot factors are not compatible to if the bloods are not compatible, okay? Then in the transfused vein, there'll be pain, there'll be heat sensation, okay? I thought I told you guys that at the site of what? Transfusion, there'll be pain, all right? Now the lumbar region, there'll be pain. At the chest, there'll be constricting pain, right? Difficulty in breathing and what? Tightness. Then in the urine, there will be hemoglobinuria. That means there's breakdown of what? Red blood cells, breakdown of hemoglobin. So you are passing out hemoglobin in urine. That's hemoglobinuria. Okay. There also be hyperbilirubinemia. Okay. So guys, that's it about the clinical features of blood transfusion reaction.